Stop buying Robitussin.
They're expensive.
Hey, I'm going to get in trouble for saying that. I'm just joking. Robitussin don't.
Hey, Jayla, can you bleep that?
Bleep that. Okay. Or don't. Whatever. Okay, let's be real. Parenting is not easy, but you are not alone. Welcome to The Parent Prescription, a podcast where I give you real practical advice to help you navigate the ups and downs of raising a healthy, happy kid without losing your mind. Welcome back to The Parent Prescription. I'm your host, Dr. Tracy Calloway Lawson, and today we're diving into a big one. The 6-season survival guide. Yes, it is December. Here we go. Right now, we're seeing lots of flu, RSV, ear infections, strep throat. We've got lots of things going on, many viruses. So we want to walk you through what's normal, what's concerning, and what actually helps at home. And I'm excited because we have one of our amazing nurse practitioners hanging out with us today, Miss Kirsten Cox. She's in the thick of it during 6 seasons, seeing dozens of kids a day, and she works in the ER also. So she has real-life, practical tips for parents. Let's get into it. Episode number 2. Okay, so like I said, I've got Miss Kirsten Cox here today. Now, you've seen her here in clinic with me. If you come here, you've seen her here in clinic with me, and she does amazing with the kids. But I brought her on because she spends time working in the ER. So she sees kids not only here, but she sees adults and kids, even in the emergency room setting. So she's going to be helpful because she sees these things. We're going to start with some rapid fire questions. Myth versus fact. I think this is going to help parents a lot because a lot of the myths, a lot of the things that we hear, we go off of thinking that it's true. And some of this stuff is just like,
Not even close.
Okay, so I'm going to test you.
Okay.
You've been in this field for a while. Here we go. You ready? Okay. Myth or fact? Green snot means my kid needs antibiotics.
False.
Hey, that's a myth. Okay, so green snot, especially in little ones, means that you need to do a better job saline and suctioning the nose, okay? Because it's just sitting there. They don't get it out. They don't blow it out. It just sits there. So, of course, it changes colors. It does not mean a sinus infection. For adults, when it turns green, I don't do adults. Maybe they automatically get antibiotics. But just because a kid has green snot does not mean that they need antibiotics. It means they need suctioned or tell them to blow it out.
Blow it.
Okay? Saline is helpful. Okay, next one. Myth or fact? Fevers are dangerous and can cause brain damage.
False.
Okay. Ooh, that's a big one. I hear this all the time. How high can the temp get before I go to the ER? ER?
Oh, that's a tricky subject there.
For a kid.
For a kiddo, we want you to keep your fever below 104.7, below 105.
That sounds crazy, right? It is so true. Give the Tylenol or the Motrin, right?
Please.
And then check it again in 20 minutes, 15, 20 minutes. Just see if it's coming down. Not if it's normal. It's not going to go from 103 to 98.7 in 20 minutes. But if it's responding to the medicine, ta-da! You don't have to go to the ER. Come on.
Even if you give the Tylenol, you wait to 20, 30 minutes later and it still hasn't come down all the way, you can give the ibuprofen too. You can alternate those.
And we say alternate every 3 hours. But to get it down initially, knock it out first, and then we'll go to the every 3 hours on alternation. So very good. Yeah.
Treat those fevers.
Okay, so that was a myth also. Here we go. Here's the next one. Myth or fact? Let me see if you get this.
Oh, gosh.
Kids can catch a cold by going outside in the cold weather.
Can catch a cold going outside? No.
There's a lot of people that think that, though.
Yes, you're not going to get pneumonia because you didn't wear a jacket because it's cold, guys.
Ooh, we're going to make some grandmas mad.
I know. Sorry, Mama.
Sorry. I know y'all say, put that hat on, put that coat on, put them socks and shoes. I mean, yes, we prefer you to have on socks and shoes and a coat and hat, but you are not going to catch pneumonia by not having on your hat and your coat. I'm sorry, grandparents. I know. That is a myth.
That is a big one.
Okay, let's do one more and then we'll get into it. Okay, a high fever means that this illness is very serious.
False.
You can have a high fever with a virus. You can have a high fever with an ear infection. You can have a high fever with teething. So that's
constipation. You can have a fever too.
Did you hear that?
If you cannot poop in, you can have a fever.
We want to talk about a few specific illnesses that we're seeing this time of year so you can know when is the right time to go and see the ER versus to stay in call your PCP and go to the clinic. Okay, let's start with the flu.
Okay.
Influenza A, influenza B. What are signs and symptoms? Let's discuss that with them.
So you got your typical flu symptoms: your runny nose, your cough, your congestion, your fever, nausea, vomiting, sometimes diarrhea with it. Just because you have those symptoms doesn't mean you have to go to the ER for emergency care. That is something that you can come in the clinic and see one of us for.
Yeah, that's true. So there's not going to be a lot of things that we'll say go to the ER. It needs to be emergent when you go. And so you can actually take care of the flu, unfortunately, with symptomatic care. So hydration, that's the biggest thing. If you're nauseous, if you're vomiting, if you're having diarrhea, you've got to make sure we've got either some Gatorade, some Pedialyte, some popsicles, some water. You know, you don't want to do too much at one time because it'll make you want to throw it up, of course. But you do want to make sure we're getting enough fluids that we don't get dehydrated. Let me throw something in there. Dehydration does not mean that the diapers are not as wet as normal. If you're having a diaper at least once every 8 hours, you are okay. Okay, I know that sounds crazy, but 3 diapers a day means that we're golden. Okay, so and then for adults and kids, of course, you want to make sure that you're drinking enough too, but definitely for our babies. Okay,
and just to feed off of that, no pun intended here. Just because they're not eating does not mean you need to go to the ER. When you are sick, you don't feel like eating. The important thing is to make sure you're hydrated.
Yes. People do that?
Yes.
They go to the ER because their kid's not eating?
They haven't ate in 6 hours.
My patients better not be doing that. Y'all stop doing that. Okay? So if I don't feel well, I am not going to eat. I'm going to drink. I might get a little tea. I might get some chicken noodle soup. So if adults don't eat as much as normal when we don't feel well, our kids are not going to eat as much as normal when they don't feel well. Do not let that stress you out if your child is not eating their normal burger, fries, and I mean, you have to really switch it back up. Okay, if their tummy's hurting, what do I need to give them? Something simple. Some mashed potatoes, some crackers, some soup, a piece of bread. Like, keep it simple so that it doesn't make them feel more nauseous. Okay, so yes, the appetite can be low, but that does not mean it's time to go to an emergency setting. I mean, the PCP is always here for you to come in. Like, you know, we can definitely see, but we're trying to tell you when it is appropriate to go to the urgent care or ER. Okay? Okay, what else about the flu? Temps can get really high with the flu. They can get 103, 104, 105. Again, treat the fever first before saying, oh my gosh, I need to go in. Okay?
How do you feel about Tamiflu?
Tamiflu and Xofluza, those are a couple of treatments for the flu. If we can catch it within a 48-hour window, then that is when it's appropriate to give the Tamiflu or the Xofluza. If we go, okay, but we've been sick for 4 or 5 days, it's not going to be helpful. It's really not going to be helpful for it because it shortens the course. It doesn't take it away. It just shortens the course. So.
No antibiotics, right?
No, unless we have a secondary infection. So sometimes you can have the flu and you can get an ear infection, or you can have the flu and then it lingers for a while and we end up with pneumonia, or things seem like they're getting better and then they take a turn for the worse. You need to be reevaluated because you can pick up a secondary infection that requires an antibiotic. But does the flu need antibiotics? No, it's viral. It just needs monitoring and lots of love.
Lots of love.
Maybe some Netflix.
Yeah, a lot of Netflix.
Yeah. All right, you ready for your myths and facts?
Let's go.
This one, you know, I heard somebody really say that they thought this was true.
Okay.
Well, I just said it was a myth. Dang it. Can you sweat out the flu?
No.
literally sweat it out. No.
You can't sweat out a fever either, guys.
No, it might make you sweat.
It might.
Yeah.
It might.
Okay. Okay. You cannot have the flu if you don't have a fever. False. Flu B especially. Influenza B, sometimes you don't have a fever, but you have a bad cough and all those things we just talked about. And you may not have a fever. And you may still have the flu. So if you're sick, you're sick. Cold medicine can prevent the flu.
Can prevent the flu? No.
Cold medicine.
Cold medicine.
Okay.
Like your
Dimetapp and Delsum and Robitussin and all of those fun things.
Can't prevent it.
Yes.
You know what can help in boosting your immunity with your zinc and your multivitamins and your elderberries, but not your over-the-counter medicines.
There you go. So this time of year, if you're not taking vitamins, or if your kid is not taking vitamins, this is a good time of the year to do at least a vitamin, a multivitamin. Okay. And if you're one of those that say, my kid gets sick all the time, at least once a month, we're picking up something, a little bit of vitamin C, a little bit of zinc, those things. And a multivitamin is fine. You don't have to go extra and do a lot. But that's one of the myths, is that cough and cold medicines actually can be helpful or be prevent. They definitely do not prevent viruses. And even under the age of 6, it's not even recommended at all. I'm sorry. Okay.
Sorry, guys.
Okay. Ready? RSV.
Oh, gosh.
This is a big one.
This is huge in the ER setting, guys.
RSV. So we haven't seen much flu this year, thankfully. RSV, we haven't seen a lot, but we definitely have seen some RSV. So RSV is a respiratory virus that, in better words, it just sucks in babies, especially babies that are preemies or that were born early. Okay. And so RSV, the main thing that it causes is a lot of nasal drainage, just a lot of nasal drainage, a bad cough, a wet or a mucousy sounding cough, sometimes difficulty breathing, sometimes wheezing, diarrhea. Sometimes kids can have diarrhea with RSV. And then the same thing with flu, decreased appetite. I'm saying a lot. I was told not to do that.
Jalen, huh?
Yeah. Blame Jalen. But RSV, you've been seeing it in
RSV is probably one of the scariest things for parents. I mean, it's the breathing. You see your kid and they look like they're struggling to breathe, and that sends you into a panic because you think your kid is struggling and you got to do something right now to fix them.
So what can we do? What can they do?
Pull all of that snot out of them. Get a warm shower going and get that steam going in the bathroom and put that baby in there with you and let them breathe in that steam. You can also use a humidifier. For our babies, there's no antihistamines or medicines that we're going to be able to give to help dry anything up. Steroids, those really aren't going to do much any which way for you. They're going to give you a perk. They're going to perk you up for just a little bit. And as soon as those medicines wear off, you're right back to where you started. Breathing treatments. Everybody thinks we need breathing treatments. Every single time.
Does it even help with RSV?
No.
It usually doesn't.
No. RSV is here. Yep. Right here. Where your snout is. It's here. It's not here in your chest. It is here. You've got to treat the symptoms here. And you do that with your suctioning, your irrigation, your steam showers, your vapor mist, your humidifiers.
Yeah. It's hard because usually for 3 or 4 days, it's rough. Usually for 3 or 4 days, you have to make sure they stay hydrated. You have to make sure we're watching the breathing. If we feel like we're breathing so fast and coughing so much that we just will not take a drink, we can't keep them hydrated because they're breathing too fast, then that may mean it's time to go into the hospital. Definitely be evaluated. Definitely don't, try to manage it by yourself at home. But when does every kid get hospitalized that has RSV?
Absolutely not.
No.
Absolutely not.
No.
Some of the things that you want to watch for at home is an increase in their breathing. You want to look to see if their little nose is flaring outwards. You want to look here at their clavicles. You want to see if it is sucking in and you can see the bone. You also want to look at their ribs and see the same thing. If you notice anything that's going on there, that sucking in sensation or the flaring here, that needs to be seen in the emergency room. That's when we want you to bring your kiddos to us so that we can evaluate them and get them some oxygen that can possibly help them.
Yeah. And that's not every kid.
Mm-mm.
So RSV sounds very scary, but usually if the kiddo is big enough, they're going to do just fine. You just have to get through that 3 or 4 day window, and then they usually bounce right back and is active, playful, and tearing up your house again. Okay? But those first 3 or 4 days are really important, and you do want to look for any respiratory distress, the things that she was talking about. Nasal flaring, retractions, those are the things that she was talking about. And definitely get evaluated at that time. Okay? I think that's it. Okay, so rapid fire, myth or fact? RSV version. Here we go. All RSV cases need hospital care. Myth.
Nope.
RSV always gets worse between day 3 and 5.
No.
Oh, I thought I was going to get you on that one. That's a myth. Usually day 3 is your peak day. Day 3 or 4 is your peak day, and then you get better. But I've had kiddos that it's the worst is day 1. And then they're just, that's it, you know? So it just kind of depends on the kid. Okay. A louder cough means a worse RSV virus.
No. No. Again, the RSV is here. He lives in this area right in here, not living here in our chest.
It looks worse than it is most of the time. Okay? It looks worse than it is. Let's do one more.
Okay.
It's not necessarily a seasonal thing, but we see it so much I want to hit on it. Ear infections. Ear infections.
Okay.
We do see it often. So, and it can be worse this time of year just because if we've got congestion and cold, we can get more ear infections. And that's true because we have like a breeding ground for bacteria. Yeah. But ear infections, signs and symptoms. So with little ones, with older kids, of course, they just say my ear hurts. They make it easy for us.
So easy.
My ear hurts. Come in, look at it, and see if it's an ear infection, and voila, you get treated. But for little ones, things that fussiness, pulling or covering the ear or sticking the finger in the ear, drainage out of the ear. These are things to look for. Fever. Sometimes that is a sign of an ear infection.
Sometimes they can have a little bit of diarrhea, and you think it's probably teething.
Yeah.
Could be their ears.
Oh, definitely.
That's
and teething sometimes is a ear when they're messing with the ears, it can be a false alarm for teething because if they feel their gums changing and teeth coming through, they'll reach up here because they don't know what's going on up here, and people think that it's ear infections, and a lot of times it's just teething and the ears look fine. So antibiotics for ear infections. So fever, an ear infection with a fever. So when we look and say, oh, okay, there are some changes of the ear, and if they've got fever with it, they'll get an antibiotic. Okay. Sometimes you will hear a provider say that the ear, so there's some redness to the ear, but we're not going to treat it. We're going to let you, if we're congested, we're going to let you dry it up with an antihistamine like Zyrtec or Claritin. We're going to see how we do over the next few days, but it will usually resolve itself. That's because it's not bulging. There's not a color change behind it. There's the kid looks fine, and they were here for a wellness visit, and we just saw, hey, it looks like there's a little bit of changes. We're just going to monitor. And usually they resolve themselves. But if we're running a fever with it, the kid will get antibiotics with the ear infection. Okay. If it's draining, they'll get drops. They'll get ear drops instead of an oral antibiotic. Okay. I guess that's really it for ear infections. There wasn't a lot to say about that.
I'm a big fan of letting your body do what it does naturally before we just throw antibiotics at you. So if I look at your kiddo's ear and it looks a little bit red, but it's pretty full, and I see you've got some snot and drainage going on here, I'm not doing antibiotics first. And it's not because I don't think your child needs them. I think they need to clear up the snot and drainage, get these tubes down here working, and then reevaluate it.
That's a good nurse practitioner. Not just throwing medicine. Myth or fact time.
Okay.
Ear infection version. Here we go. We just went over this. All ear infections need antibiotics.
Negative.
Myth. Ear pulling always means an infection.
False.
False. That's a myth too. Swimming can cause ear infections.
Swimming?
Mm-hmm.
Oh.
Oh.
So I'm going to say it's plausible because your ear canal that sits there and kind of festers with all that natural flora and bacteria and skin stuff going on in your ear, that can cause an infection.
So that is a fact, okay? Usually that's otitis externa is what we're talking about. So an ear infection that creates a lot of pain even when you move the ear.
Mm-hmm.
And so that actually is true. And usually that's taken care of with antibiotic ear drops. Okay, very good. Okay, so let's do a few more just for fun.
Okay.
So home remedies.
Oh, Lord.
I don't know a lot of these,
Lord.
you guys.
Okay.
I'm going to tell you the truth. A lot of the things that great grandma taught you, some of it really works. Seriously. If it's not going to hurt them, then I go, okay. And you'll just see me say, okay, because it may help and it may not. So, but it's not going to hurt. So let's just go over a few of them that we hear. Garlic in the socks. You've never heard that one?
I've heard of like minced garlic, like you rub it on the feet and put the sock over it. But I don't like the way garlic smells. So I would just use Vicks on the bottom of the feet.
Yes. But garlic, do you think it can? What do you think? Myth or fact?
I'm gonna say false.
Wait, hey, if you want to put some garlic in the socks to help the virus go away a little bit faster, then use your garlic. We're okay with that. It's not gonna hurt anything. Okay, what about onions? Hanging onions in the bedroom.
For what? What's it doing? Like soaking up bacteria and viruses?
It's sucking it up. I don't know.
No.
Okay, the onions, we're on the same page. We don't think the onions work, y'all. If your great grandma told you to do it, do it. A cold bath or a cool bath to bring down the fever.
I have mixed feelings about this.
Okay.
Will a cool tepid bath bring down your fever? Sure. I think it will. But do I think you absolutely need to do that just because you have a fever? No. I think having a fever is your body's way of raising the temperature to where you can fight off whatever's inside of you. And it needs to stay just a little bit higher so that your body can fight off whatever's going on.
There you go.
So
our body is doing what it's supposed to do. Now, if it gets over 101, then we're irritable and we need to treat it. But yes, our body naturally does that to fight off what we're doing, what's going on. Okay. Okay, good. Honey for cough. This is my favorite. True. It's my favorite. If you will hear me say it, taking a spoonful of honey or doing some tea, some warm tea with honey and lemon. Those things are helpful definitely for cough. Prove me wrong.
Honey has a lot of antibacterial properties.
There you go. Honey is better than cough syrup. Mm-hmm. But yes, buy as many cough and cold medicines as you want. But honey is the reason that it makes it better. The ones that have honey in it or getting some local honey works better than cough syrup. Okay? All right. I don't know this one. Essential oils.
I'm mixed on it. Peppermint oil, good.
Okay.
To help with like some congestion.
Okay.
Your thyme, your lemon oil, those are both good to help with some cough and congestion.
Okay.
You can put those in a bath. You can put those in a diffuser while they're sleeping to help open things up a little bit more.
Okay. There you go. You heard it. Peppermint.
Essential oils like your thyme. Or is it thyme or thyme?
I thought it was thyme.
Thyme, whatever. THYME. Get that stuff. Your lemon oils.
What about lavender? I hear that one a lot.
You know, lavender, there's lots of research out there that says it's good to help with sleeping and relaxation and kind of a stress.
Oh, maybe I need some lavender.
We need to spray that everywhere.
Okay. Okay. Last thing.
Okay.
Let's do some funny ones for parents. Life myths and facts. Ready?
Okay.
If your kid was sick and starts running around like normal for 10 minutes, does that mean the virus is over and they can go back to school?
No. Good try,
Sometimes
guys.
Kids will do that, especially when the fever drops and goes back to normal. They'll be fine for a little while, and then as soon as that temperature starts to go back up,
we're crashing.
Here we go. Then we're clingy and whiny and fussy. And so, yes, no, don't take that window and go, you're going back to school right now. Like, no, 24 hours fever-free, guys. 24 hours fever-free. Kids only get sick at night because they're dramatic.
No. No. Typically, it's going to be in the evenings because that's when the viral replication process starts.
Sorry. It usually starts at night, guys. Okay. I wish this one was true. Screen time makes kids sick.
I wished. It does not.
It doesn't.
But if you want to start like making that like into existence, we could.
Hey, we can say if you get more than 2 hours of screen time, you're going to get sick.
You're going to get sick.
And see if that will fly as a myth that sticks.
If the kids hear about that, they're going to stay on their screens longer, though.
Oh, so they don't have to go
they're
to
sick
school.
And they don't go to school.
Oh, man, that won't work.
That.
This is a good one. Daycare builds their immunity so that they don't get sick as often. I like that
their immunity.
Well, I mean, that's not true.
Like herd immunity, I guess, but
well, what happens is they'll pick up things earlier than they would if they waited until kindergarten to start school, and then whatever. They see these viruses. If they have already seen them at the age of 1 and 2, then their body's like, oh, I've already seen that virus. I don't have to get sick for that one.
Yeah.
I mean, there's lots of viruses, though, guys. There's so many out there. So anytime kids are around a large number of kids in a small space and one comes in sick, they're going to pick things up.
They're all going to get sick.
So it's just, especially between October and February, it happens. Okay, it just does. Even if you're washing hands, sanitizing, you know, it happens. But yes, if they do go to daycare, usually once they start actual school, they don't pick up as many viruses. So I kind of like it.
I do like that one.
Last one. This is a good one. If you Google long enough, you will find your right diagnosis.
Nope. You're going to find everything but the right diagnosis, actually.
Oh, my goodness. So Google, I always say this. I love Google, by the way. So please don't shun me. But Google can kill you in 3 clicks. It doesn't matter if you start with a rash or a cough or a scrape or an ant bite. If you click the wrong 3 times, it will say you're dying.
In 6 months or less.
Period. And you will be running to the ER
for a hangnail.
For no reason. Like, do not be careful. Don't do it. If you want to know what's going on and you say, I really just need to get this evaluated because it's making me nervous, call your PCP. Okay? Please. Call your PCP. Let them get you in and look at the scrape and make sure that it's not impetigo and that you're not dying. But I'm telling you, Google can make you feel like you're on your deathbed. Okay? I think this was fun. What do you think?
I think so too. I think parents need to know to trust your gut. Like if you think something is going on and you just have this feeling like your kiddo is not right, come in and take a look at them. We're not going to care.
Yeah.
And honestly, I'm not going to care if I'm working in the ER and you come in and you say, something's not right with little Timmy. Like, he's just not acting the same. Because my job at that point is to not only make sure he's okay, but to give you reassurance that you're doing everything that you're supposed to be doing at home.
Yes. But try to use your PCP.
Please.
You guys, the emergency room is used for emergencies. It's really hard when people say, I had to wait for 6 hours in the ER. And I have people come in and say, and they didn't even do anything. It's like, well, the reason that is because it wasn't emergent. Usually, I'm not going to say in every case, but most of the time you're waiting for that long because they're doing their emergencies first. And so when you go in for something that could have been done in the primary care's office, in your PCP's office, that would have taken the waiting room wait instead of a 6-hour wait, then you're using the resources incorrectly. And we're trying to say the ER wait is long because we're using it incorrectly. Use your PCP. Use your PCP. I understand it's during the 8 to 5 hours. Some of your PCPs have a weekend day that they're open, or they have night hours, but most of them are between 8 and 5. And so I get it. It's an inconvenience to a working parent. However, going to the ER is also an inconvenience because you're exposing your kids to other things. We went over flu, we went over RSV, we went over ear infections. We talked about when it's appropriate to go to the ER, when it's better to call your PCP, and we talked about myths and facts for sick season. So I hope you enjoyed this second podcast. I'm having fun with it. I hope it is encouraging you, and I hope that it's helpful. And you never know who's going to show up with me at these. I have lots of friends. So we'll just see for the next podcast.
Artlist.io. Step by step, raise the whole room higher.